Welcome to this video on COVID-19 health protocols. Have you ever wondered about when this pandemic would end? Don't you wish to live an ordinary life again with no restrictions? Yes, I bet everyone would want this pandemic to end. Since the beginning of the spread of this deadly disease, COVID-19, a lot of people have been suffering from the repercussions of this worldwide crisis. More negative effects were inflicted than positive ones. In this video, we will talk about the implementation and efficacy of health protocols in the Philippines. We will focus on the different health protocols implemented by the government to combat the current pandemic and will assess its effectiveness. We will also suggest possible improvements to the current health protocols that have been put in place. This serves as an analysis for people to know what measures to take in order to prevent the virus from escalating. Moreover, it serves as a reminder on the importance of health safety so that we come to understand how a situation as grave as the COVID-19 pandemic should be handled, the significance of following the rules and protocols put into place by authority figures, and how something as simple as obeying the protocols put in place can already be of great aid. Before starting, we should know more about this topic, COVID-19. What word comes to your mind when you hear about this? Most people would say quarantine, isolation, masks, and online schools, since these are some of the health protocols implemented by the government for us to comply with. For a better understanding, here is a little background. COVID-19 or coronavirus is known to be a respiratory tract infection which can infect both the upper and lower respiratory tracts. A few of its main symptoms include fever, coughing, chills, and shortness of breath. It first struck in early 2020. It only took 2 short weeks for the pandemic to sweep across nations all around the world as a deadly disease that has claimed the lives of many and will surely continue to claim many more. Over a year later, in the early months of 2021, the virus has become the biggest threat to human society, challenging governments, healthcare systems, and establishments as they struggle to effectively combat the quickly spreading disease. Hence, the government has implemented health protocols. Health protocols are a set of guidelines describing a procedure to be followed to investigate a particular set of results in a patient, or a method to be followed to control a particular disease. Currently, the Philippine government has employed contact tracing, class suspension, a quarantine, and a travel ban to name a few of its preventive measures. Yet the country is still seeing a steady rise in infections, with around 530,000 cases nationwide as of February 4, 2021.
A few Filipino individuals about their knowledge on health precautions in the Philippines. My interview content ranges from precautions taken at the mall to precautions taken upon arrival in the Philippines. My 29-year-old uncle, Quizzy Yase, currently works as a nurse in Brooklyn, New York. To summarize his evaluation of protocols in Manila and CDO from a scale of 1 to 10, it would be about an 8 or 9. He said that it was good that there are thermal checks and swab tests for travelers. One thing that he didn't totally understand was upon arriving in a hotel quarantine site in CDO. He mentioned that the travelers that arrived at the hotel were allowed to get food or run errands before their respective quarantines. Thus, this would defeat the whole purpose of quarantine when you're exposing yourself to the public. Now let's go to the second part of my interview. I divided the responses into 3 sections: adults, teens, and kids. Here are the questions asked. First, in the adult section, we have my mom, a former employee as a nurse in El Camino Hospital in Mountain Dew, California. She says, in response to the first question, to contact senators and counselors to lobby a law to make hospitals accountable. The government should penalize hospitals that fall off the health standards. For teens, one response from an older cousin is, a solution would be to spread awareness on our current situation. I think that the lack of health protocol usage is because of uninformed individuals who do not take COVID-19 seriously. For kids, my 12-year-old cousin says that we need to see people wearing more masks. She says, I've seen people everywhere without masks in several jeepneys. My 11-year-old brother Steven says that if the individual lacks masks, the government should provide. If they are not wearing them, then the government should warn and tell them the importance of wearing masks. Let's go to the second question. I focus on the answers of the minors for this one. Are they responsible citizens? Let's find out. Under teens, my 15-year-old cousin says, I consider myself a responsible citizen because I follow rules like using masks and being hygienic and only going out for important things such as grocery shopping or family gatherings. Under the kids section, my cousin says, no, because she doesn't wash her hands before she eats. Remember to wash your hands, guys.
Talked about the pandemic. We've heard the accounts of several members of our community. Now it is time to act. What can we do? Our fellow citizens, the smallest of actions can have the greatest of effects. Number 1, take heed of the health protocols put into place by the government and practice them. Mask up, social distance, and stay safe. Number 2, stay informed, especially in such trying times. The proper dissemination of information should be a top priority for both local and national governments. Number 3, stay kind. Above all, these are difficult times for everyone. The lockdowns and quarantines are foreign experiences that we're all trying to adapt to. Be kind to yourself, be kind to others, as we all try to get through this pandemic together.